take you back to 1996. Everybody here looks pretty young. He wasn't around in 1996. Were you around in 1996? Okay. You probably weren't doing what I was doing. In 1996, I was in Texter Hall. It was the biggest lecture hall at Ithaca College. That's where I went to college. And freshman year, I got my Ithaca football shirt on. I got all my books were sitting there. Really excited. And the chair of the department stands up front. If you've gone to college before, then this probably sounds familiar. And he says, look to your left, look to your right. He said 50% of these people are not going to be here in 5 years when you graduate. Sure enough, graduated with 60 kids from the physical therapy program. So, what does that have to do with what we're talking about today? If you guys read our flyer, what's the first thing that it said in there? Anybody remember about the statistic about injuries in CrossFit? So it said somewhere
30% that it's not injury or something like that.
Yeah, that's where you're close. 25% don't get one, right?
Yeah.
So almost over 70% of people sitting here, statistically speaking, we're going to make changes statistic with you guys. You guys aren't going to get hurt. But if you go out there, most of those people, if you look to your left and right, are not going to be here in a year. Okay? Because they're going to have some kind of injury that will keep them out of workouts or keep them from competing. And some of those required surgery too. So my name is Travis Robbins. This is Nick Karowski. We work for Robbins Rehabilitation. And we have 5 offices here in the Valley. And now we have one right there. So we're on site here at South Mountain CrossFit. So we are geeks about movement. That's what physical therapists are. If you saw us in the other room, we were just kind of watching people move. So that's what we do when we go to the airport, the mall, where we have to hang out with our wives or girlfriends and they make us do things. We watch people move because that's what we really like to do. And most of the movement that we see could be improved or are just complete train wrecks. And they're just like ticking time bombs that are waiting to explode. Right? So we want to try to teach you guys a couple things today, 3 things actually, 3 of the most common things that we see with not only CrossFit athletes, all of the athletes that we see, and even some of the older population that we see, to have something that you can take away today and use tomorrow in your workouts. Okay? All right, Nick, take it away.
All right, so we're going to start off, quick talk about Lumbopelvic Neutral. What does that mean? It means keeping your spine in a neutral position, really. And what that really looks like on a spine model here, hey, a little bit of a curve right here, a little bit of a curve right here, and a little bit of a curve right here. Everything in relative neutral. Spine is meant to have a little bit of an S-curve. Now, I'm going to ask somebody to come up here because we want to take a look at that. So this is where you guys get to volunteer.
He has a really good look at spine.
Yeah.
All right, Sam, let's go. Right?
Come on up.
This is cheating. I looked at your spine already this week. She knows what to do. Okay.
You asked her a good look
All
at
right,
the spine.
all right.
Well, here, turn so kind of everybody can see it from the side for a second. So, hey, there you go. Okay, what does that mean? Okay, it means nothing, right? But I'm going to put PVC pipe up to here. And what I want to look at is areas of contact. So, to maintain a neutral spine, she should be able to have the back of her head touching here. So we have some forward head posture. Middle of the back is touching. I can slide my hand in here, and I'm guessing my hand's a little bit bigger, right? A little bit bigger, yeah. My hand's a little bit bigger. She should be able to slide her hand in there and have it touch the PVC in that small space, and then also be touching on the low back here. Now, maintaining that position, so don't relax for a second, but we're going to go over how to correct that, but maintaining that position is extremely important because if you're not there, you're going to be just dumping strength. So Travis is probably a pretty strong guy here. So let's take a look. Let's see what the importance of a neutral spine. Oh, hold on. Yeah, you're not going anywhere.
Let's see somebody else. Because
Let's
if
see
you take me,
somebody
I might be
else?
fake.
All right. Who's the strongest one in here? Anybody?
Someone's got to stand up, but we cannot.
Or we're just going to go right here.
We can do that.
All right.
All right, here we go. Nice.
Second strongest.
Second strongest. All right. So, go ahead. Put your arm out straight here, just like that. Don't even bend your elbow, okay? So don't even bend it. Don't even bend it. All right. So now what I want you to do, you're just going to look back as far as you can there. Don't even bend your elbow now. Don't even bend it. Don't even bend it. Come on, don't even bend it. All right. So right away, I'm starting to bend. What does that do? It's because his spine, I brought it out of neutral. So thank you. Go ahead, have a seat for a minute there. But that's important to look now, because what did I do? I took his nervous system and I just crunched everything down. Everything just went. I can't fire, I can't function. So if we're looking at getting injured, hey, we're going to be more likelihood to get injured if we can't maintain. So again, we're talking lumbopelvic neutral here, but we're going to go over just the entire spine because it must be the entire spine that is neutral, but also performance. So if you want to be strong overhead, if you want to be strong in your squat, deadlift, your clean, your pull, whatever it is, that spine has to be there because the neutral position is still the strongest position out of all. So now we need to just do a little quick correction. So come on, stand back up here again for us, please. And we're going to go over how to just correct that. So first thing, upper back may be off a little bit, so the head may be a little bit more challenging to correct, but we're going to go over that next when we talk about the overhead shoulder. But try and tuck the chin in, try and bring the head back out here. So now, so when she did it, that was kind of that same looking back that we just showed. So we want to keep that chin tucked in though now too. So now this is a much stronger position for the neck, for the shoulder girdle, everything for the upper extremity. Now also, so let's go ahead and put your hand in the back there. And so that's slide right in there. And there's still a little bit of space, so go ahead and tilt your hips backwards. Okay, so see which way she went? She started going forward, which is commonly what you're going to see. And that's that same thing. So if I'm going forward like that, that's the same thing as looking up here, just crunching everything down again. So I want you to think Donald Duck, Pink Panther here. So I want everybody to kind of see that, where I'm going into a Donald Duck posture where I'm getting really arched, versus Pink Panther where I'm tucking way under. You kind of have to find that rocking of those hips, that going from that Donald Duck, Pink Panther, and finding where that neutral position is. So let's go ahead, putting the hand back there again. So we have 1, 2, 3 points of contact. So bring the hand right up into the arch. So going into the Donald Duck there, let's Pink Panther a little bit. A little bit more, a little bit more. Nope, nope. So see, it actually is a little more challenging. We want to think about tilting the hips backwards. So just go ahead and relax your hands for a second. So go ahead, tilt forward, and then go ahead and tilt back. But try and stay up here, tilt the hips back. It's actually more challenging than these things. So this is a perfect example, so thank you for doing that, actually.
Right.
We can go over this a little bit more at the end, but I want everybody to have that as an idea. That spinal neutral is not the easiest thing in the world to figure out. Like,
Totally.
you kind of even see it, like, where do I go? Do I lean back further? Do I tilt under? And that's where, this is just in standing. I mean, there's no weight here, there's no load, there's nothing else, but it still is a difficult position to reach.
And so one of the things we like to say is with our patients, or with anybody, is wherever you are during the day, I'm going to come around and follow you, and I'm going to slap a pole on your back. Right? And whatever you're doing, sitting, standing, walking, lifting, over in the box, I should be able to put that on your spine. Now, it's not an easy concept, but it's worth putting the investment and the time into kind of figuring that out. It doesn't take much, and it's very easy. You guys can do that. Like, you can take a poll and go home and do that and say, hey, yeah, I can figure out where that is. I might have a hard time finding it, but if you work on it enough, you'll figure it out, and you don't need a master's degree in physical therapy to figure that out. But that's like, all of the concepts that we talk about today are going to be really weighted, and then this is like the foundation, the base of what we should do. So kind of try and find that level neutral is really important. Make sense?
Am I good?
Cool. Good for now.
All right.
Nice. All right, that's good. All right, next we're going to talk about is shoulder elevation or overhead work. You guys do CrossFit, decent amount of overhead work, right? Okay. So there are a lot of things that have to happen correctly in order to go from here to here correctly. Okay? So the main parts of motion that occur at the glenohumeral joint. So I'm sure you guys probably know what that is. It's probably referred to as like a ball and socket. It's really more like a golf ball sitting on top of a tee because of all the motion that is available at your shoulder. Right? So if I go from here to here and I get proper motion, 2/3 of that motion come from my glenohumeral joint, and 1/3 of it comes from how my scapula moves. And that tends to be where we see more of the problems occur, is a lack of scapular, what we call upward rotation, or if you look at someone's shoulder blade, is that thing moving properly? So if Nick turns around here, so here's his glenohumeral joint, that's like the ball and socket thing. This is his scapula, and when I say upward rotation, it has to kind of elevate and turn up like that, and then come back down. So if Nick lifts his arm up here, what should happen is his inferior angle of his scapula, or this little bump here, should come to the middle of his rib cage here. And it actually does. It does a really good job of that because he knows how to do that. But let's have somebody stand up. Doesn't have to be strong, but you do have to be over 4 because he probably has a really good upward rotation of his scapula. Anybody else maybe that has some shoulder problems or okay. Done. All right, come on up. Okay. All right. Yeah,
Either one.
Either one? Both of them bother you?
Well,
Okay.
it's not. Yeah, I guess this is worse.
Okay, all right, come stand over here a little bit. All right, so from here, all you do is with your right arm, I just want you to lift this thing up. I want you to try to lift this up and back as far as you can go. Okay, so when he gets up here, if you look at it, I mean, in general, that looks like pretty good shoulder range of motion, right? He's got his arm straight up. But where is his inferior angle of his shoulder blade? It's kind of back here. It's not terrible, okay? But it's got to be here. So if that's not getting there and he's getting good shoulder range of motion, he's making a compensation somewhere. And the most common compensation, do you have pain in the front of your shoulder? Yeah. So the most common compensation is in the anterior part of the shoulder. This is where everything gets messed up. So if you hear of rotator cuff issues, the rotator cuff is just a group of muscles that kind of holds that golf ball on the tee. And if there's an irritation, you often hear bursitis, tendinitis, tendinopathy. Any kind of anterior shoulder pain is typically coming from the fact that his scapula is kind of lagging behind. And if I get to here, my scapula stops. If I want to get the rest of that, what have I got to do? I've got to jam everything in the front of this shoulder, and that's what causes a ton of problems. Right? So for you, we've got to find out if this restriction is an active or a passive restriction. So if that shoulder blade isn't coming forward, if it's what we call a passive restriction, meaning there's some kind of soft tissue restriction, there's some kind of mobility issue with the soft tissue of the fascia, if there's a tight muscle, other connective tissue that is restricting that, that's kind of, as heat goes up, if something's kind of pulling this back, then that could be one of the problems, okay? Another problem is what we would call an active restriction, where it's the muscles, there's 17 muscles that attach to your shoulder blade. If all of them don't work properly, then if just one of them is off, then you're probably going to have some problems with upward rotation of the scapula. Most commonly, the lower trap and the upper trap are common muscles that if they don't activate properly, it doesn't cause this kind of turning action there. So we have to find out if that's an active or a passive restriction. And the other thing that we look at with shoulder elevation, we're going back to the Lumbopelvic Neutral, because that's what we do a ton of, right? I want to try to see what happens when he lifts his shoulder up. Well, I got a pull on his back, so go ahead and lift that up, okay? So his head should be here, right? We talk about whenever I follow you around all day, I slap this on your back, you should be able to do that. So that's pretty far off. So he's making a compensation, and he knows he's got to get his shoulder back, but how does he do that? Does he do it by kind of getting his head forward like that? That's what the common compensation, right? Because now it kind of looks pretty good, right? If my shoulder's out here, but I get my head forward, not so bad, right? Or if you get extension from the lumbar spine, so not too bad with him, but you have to get proper extension out of the thoracic spine, which you might not think about the spine, the thoracic spine having a lot to do with your ability to get your shoulder up. But if you don't get proper thoracic extension, you can get it either by kind of shoving your head forward, or some people you'll see is they'll kind of get their back, right? So if my shoulder elevation looks like this, and I don't do it in my lumbar spine, but I do this, well, it looks pretty good, doesn't it? So those are the two major compensations I would say. So, Nick, what do you want to look at for corrective thing that we can do for that? You want to do? Do you think it was more thoracic spine, or do you think it was more scapular?
It looks like more scapular.
Okay, so we're going to do like a ball.
Yeah.
Okay. All right, so Nick's going to we're going to go through an exercise that, and you can see on the bottom of your sheet there, we have a page on our website where there's corrective exercises to kind of fix problems like this. So there's a video of us kind of explaining this exercise that you guys can definitely use.
This exercise is the lacrosse ball scapular release. Great for anybody who is lacking overhead motion, can't get elbows up in a front squat, could bring the arms back in a squat position, just any dysfunction of the shoulder, any pain in the shoulder, any problems moving it. So Travis took the lacrosse ball, and again, he started with it right at the base of his neck, just off to the side, in between the scapula and the spine. So he's getting right into the soft tissue here. And he's going to start up nice and high. He's going to go ahead and lift his hips up to load through that point. And from here, he's going to take his arm overhead. As he does this, again, thumb is facing up, elbow stays straight, and just oscillating back and forth. When he goes down now, he's going to go to the opposite hip with that thumb, just going back and forth. He can go ahead here, 15, 20 repetitions. Again, finding that tight spot, finding that sticky spot, and working through it. As he works through it, he's going to go ahead and relax down, and then he can just shift his weight up. So this will move the lacrosse ball down, making sure that you keep it in between the scapula, so in between that bone and the spine, in the soft tissue along there. And again, same thing with the arm. Just go ahead, overhead. And here he can play around, see if he needs to lift his hips up to load the tissue or not. He may or may not need to. Always keeping the elbow straight and just following the thumb there. Spending about 2 minutes of total time just getting that scapula to release so that he can work on his overhead motion.
So he would do that on both sides then?
Right, correct,
Okay.
correct. And actually this will be a good example because we can see that, we can still look what the other one looks like.
Yeah.
So go ahead, sitting up. How does it just feel even after doing that?
Lightheaded? You're right, buddy? All right, so go ahead and same thing, lift this arm up as far as you can go. Good, so he's getting a little bit more thoracic extension because he had the ball down on the thoracic spine and the ribs there too. And now, did you have any pain before we did that?
No.
Yeah, so the motion is better.
Here's one thing. His elbow is now straight too.
Yeah.
That I don't have time with.
All right, when you did it at first, go ahead one more time. So we can still work on extension there too, but on the first one, his elbow was really bent in like this because that's what you're just trying to get that arm overhead, and now your elbow is able to straighten out. And again, you're going to be stronger in that position because now think about it. When you're trying to press, you can't press from here just as easily as when you're locked out. You can hold a lot more weight overhead too.
Come back down and then just kind of bring your head back too, so it's kind of touch the pole. So the tough part about this is when you say someone to bring their head back to the pole, they typically do something like this. Well, this is like the position we told you not to get into, right? So it's more.
Yes, that's a good correction actually.
Translating your head back as compared to just getting extension in your upper cervical spine. So it's more kind of finding that. So you can get it, you know?
And he actually just, like he was there and he just went, he tucked the chin in,
Yeah.
and it's tremendous difference right
Yeah.
there.
All right, so bring this up again. So, yeah, and now it's a ton better because you can't get proper shoulder elevation if your head is forward like this. If your head is forward, your whole spine flexes forward. And if your spine flexes forward, especially the thoracic spine, you're not going to get the extension that you need to get the end range type motion. Make sense? All right.
Great job. That was awesome.
All right, next Nick is going to talk about the squats. You guys do some squats in CrossFit?
Never.
Never? Go ahead, Nick.
That's it. What's your squat look like here? All right. Go ahead, come back up.
You want me to have my heels planted or?
I want you to do a squat that you would do in the gym. All right. So go ahead, come back up. I want you to go ahead, turn a little, just so everybody can see from the side here too. So go ahead, squat down again there. All right, and go ahead, come back up. So I'm going to be looking at a couple different things here with the squat. First thing I'm looking at, go ahead and just facing everybody this way for me, and just normal stance there. All right, so we're starting at the ankles, foot, and look at, not quite straight ahead. And that's the first thing we want to see, are the feet straight ahead. Now, I'm not saying we're going to get that right away today, but it's going to take time. That's what we want to think about looking. Up to maybe a 15 degree is okay, but we don't want to see way out to the side, because if you go way out to the side, it's probably pretty easy to get down there.
I was
and get a little bit.
squat.
Right.
I take and just go
Right.
shoulder width and move it out.
But no, this is exactly what I want to do. So first we're going to be looking at the feet. Next thing, go ahead and come down again. And so go ahead, keeping the heels down for me, please. So we're looking at the knees. So his knees aren't collapsing in, but part of that, actually maybe a little bit. So we want to be looking at the knees. Are they dropping in, or are they coming and staying out over the feet? So a lot of times when the feet are pointed out, you'll see the knees dropping in. And then next, go ahead and turn in again, just so everybody can see from the side a little bit more. And go ahead and squat down again. And actually, so we were talking Lumbopelvic Neutral. So I can't even get my hand in there. So he's already rounding his back off there, and then not even really touching for the upper back here. So we want to look at those hips. So is that spine, lower back able to stay in neutral? And is he rounding forward just from the top here, just to be able to maintain that upright posture, not falling forward, falling backwards. So again, this is critical because you think about every movement is basically where you're starting from the squat. Like it is just an absolute must. But we want to look at, again, those key areas. So foot and ankle, where are the feet at? Knees, are they caving in? Back, is it able to stay in neutral, as we talked about before? And upper back, I mean, are you just rounding off forward there, or are you keeping that chest nice and tall? Because that's going to be, again, your power position. Travis, what do you think?
So keys I want you guys to think about too is we're trying to, like we're seeing a lot of different stuff in there. We're pulling out the really big things, but we try to give you norms of if you do this, it's really hard to screw this up. If you keep your toes straight ahead, it's really hard to screw up a squat from the ankle position, unless you have a restriction in that ankle, which causes more problems. But if you start out like this, you have no other alternative but to kind of dive your knees in like that. Now, it's exaggeration, you don't look like that.
Right.
But if you can keep your toes straight ahead, it's really hard for me to kind of cave my knees in. And when I kind of get down into a squat position here, what we want to see, and you'll see it's a common compensation what you did, is if you don't have the ankle range of motion to do that, this is what you'll do. You'll go up like this. Everyone should be able to keep their toes straight ahead, knees down like this, and hang out like this in a neutral spine for 10 minutes a day. Okay? So nobody does this. Like, when's the last time you hung out down here? It doesn't happen, right? It just doesn't happen.
But now you said, how often does he do that?
All the time. Right. That's why he has it. So when he goes and gets older and sits in school all day and then gets a desk job, he's gonna look like us. Unless we do something to intervene, kind of clean it. And the good news is it's not that hard. You know, it's not that hard to get down into that position if you do it a little bit during the day and try to kind of carry that through. But getting through that full range of motion is really, really important. So what do we want to do to try to, what do you want to attack first?
Well, just based on going up on the toes, I was
Yeah,
gonna say
stuff,
calves, but
yeah.
don't have good. Is yours
You
now too?
can go all day, 15 years of construction, doing something the wrong way,
You wear boots all day.
Boots.
Yeah.
Big heel on them.
Yeah, yeah. So the other thing, if he's got a big heel on his boot, what's happening? He's spending all day like this, right? So of course he can't get his ankle range of motion is up here. He can't get it down here. So when he gets down here, he wants to get into his boots and do that. Right?
This exercise is the calf release. So we have a foam roller here. Travis is going to be laying down. And this is great when you have just tight ankles, tight calves, can't get your knees far enough forward when you're trying to hit the bottom of a squat, start falling back, anything like that, compensating in other areas because you don't have the ankle motion. This is a great one for that. So Travis is already in position. He has his one leg crossed over the other. This way he can get a little bit more tension down through that leg. He can go ahead, find a tight spot, and then he's going to be pointing toes back and forth. This way, again, tacking down that area and just moving back. You can go side to side, again, finding whatever's tight. You can then roll back and forth too. So just rolling side to side. And again, finding any areas that are tight. Spending about 2 minutes messing around, finding what works for him. And what he can also do then, if you have somebody around that can help you out. So he's going to just go ahead and straighten the legs out here, taking this one off. And we're just going to find, again, those tight areas. And you can have somebody else then pressing down, just rolling back and forth. This way you can get a little bit more tension through there because the calves oftentimes are very tight and need a little bit extra help.
So we're going to work on this for a couple minutes. While we're doing that, we'll kind of wrap up. So we've given you 3 things that you can kind of take today. The idea of today was to be able to take something from here, get more information on there, videos on the website that you can use in order to help improve this. And when I sat down with Nick, we're like trying to, okay, how can I, in like a 30-minute to 20-minute lecture, how can we, get all of our information out of our brains into your guys' brains? And these were the 3 main things that we thought of, and they're pretty easy and pretty easy to assimilate into what you do. If this stuff isn't working, then what you need to do is see one of us. So what we get a ton of is we'll be in the grocery store and we'll see an old patient, or we'll be at a family picnic. This happens all the time. And your aunt will come up to you and say, oh, geez, it's my back, it's right here, and I got pain down to here, and it's worse when I sit, so what do I need to do? I'm like, well, do you have an hour? And I look at you like, it's crazy. Everybody's different, right? So every back pain with radicular symptoms is different. Every person that has shoulder pain is different. Now, the quick stuff that we did with you today will work generally for most people, but if there's something more specific going on, if you're having pain with movement, if you're not moving properly, if you're not moving the way that you used to or the way that you want to, then it takes some kind of intervention. And another analogy, physical therapists use a ton of analogies, so another analogy is a problem's typically not going to go away on its own. And that's not just a problem with body, that's a problem with almost anything in your life, right? It's probably not going to go away on its own. If you have a leak in your roof, that's probably not going to go away on its own. And the more you let it go, it's probably going to get worse, right? So you have a leak in your roof, maybe it screws up your ceiling tiles, you let it go, and then it starts to run down the wall, and it chews up all the wall. And then it runs down into the basement and starts causing problems there. And then eventually it's like huge problem that if you had just kind of cleaned up the leak in your roof, then you wouldn't have had to have all those other problems. And if it sounds like I'm talking about that in details, because it just happened in my house. I didn't fix the leak in my roof, and I had all this drywall that I had to rip out, and it cost me a ton of money. And I was like, why don't I just fix that stupid thing when I first saw it? So when you're first seeing problems with movement, you guys should be able to move normally. You're all really young people that shouldn't have pain with movement. If you're having pain with movement, like you're saying you have a lot of anterior shoulder pain, that's not normal. Like don't assume that as normal. The body can get away with amazing things, like truly amazing movement dysfunction your body can get away with. But eventually, we say in physical therapy, you can't avoid this forever. Like eventually you're gonna have to come see us to kind of get things fixed. Try to use the stuff that we gave you. Again, that website that's on there, all of that stuff is really good general kind of exercise mobility stuff that is going to be applicable to almost everybody in here, so use that stuff. But if there's something serious going on, I'm here Tuesdays and Thursdays. As we get busier, I'll be here more. But we have 4 other offices in the Valley. We're up in another office in Allentown, Bethlehem, Nazareth, Phillipsburg. If you need physical therapy, come in and see us. If you're not having any pain and you think you're moving okay, another thing that we do is a fame screen. So it's a screen that Nick and I developed specific to CrossFit, where it's like a 13-point check system. You ever get that flyer in the mail for your car, like 13-point check system, like $29.99. That's what it is. It's free for you guys because we rent space here. So it's looking at this and then like a bunch of other things, just to kind of see if there's things that are going on that maybe we can be a little bit more proactive, be on the front end of it, instead of seeing you when you have a rotator cuff tear and now you're in a sling because you had surgery. So our information is on there. You have both our emails. If you have any questions for us, we're always available on email, and we're going to hang out here a little bit because somebody has to eat all that food. I want to thank you guys for coming today. Coming on your Saturday. That was really cool. I want to thank Bragg for having us here at South Mountain CrossFit and hosting this. And if I don't see you in my office, then I'll probably see you in the box working out. Thanks, guys.
Thank you.
Hold on, we're not done yet.
Oh, wait, we got to look.
We're gonna see
Let's go.
that.
See if we did anything.
How's it feel, Chris? A lot of blood going there?
Yeah, there's a lot of
Something going on there.
as far as my left and my right, yeah.
Well, but no, you feel a huge difference now. And let's even look. So go ahead. And
Is that toe better? That's
yeah, I was gonna say toe, but also look at the, if you can look at, we're probably picking things out because we look at it every day again. Look at the knee. There's a slight difference in the knees, but it's almost like he's like, to exaggerate it, this is what he's doing. So that one leg is actually, that knee is staying out further now. Like Travis said, the toe is able to maintain a neutral position. So it really will make instant difference. Now, is that going to stay forever? No. But he's going to work this in, throw it in a couple times a week. And again, injury prevention, injury risk is going to go down. Strength, performance, everything's going to go up. And so.
Thanks.
Thank you.